Welcome, everyone. Today, we're diving into an incredibly timely and important topic: global and cultural considerations in evidence-based medicine, EBM. As the world becomes increasingly interconnected, healthcare and medical practices are crossing borders at an unprecedented rate. With this globalization, it's no longer enough to simply understand the evidence. We must also consider how that evidence applies to diverse cultural, social, and economic contexts. So, why is this important? Let's start with a simple thought. A treatment or intervention proven effective in one country may not yield the same results in another. Why? Cultural beliefs, healthcare systems, and even societal norms influence how evidence-based practices are implemented and received. In this tutorial, we'll explore the globalization of healthcare and its impact on evidence-based medicine, cultural competence and why it's a cornerstone of modern medical practice, how to navigate challenges and opportunities when applying evidence-based medicine in diverse settings. By the end of this session, you'll not only understand these global and cultural nuances, but also walk away with practical strategies to ensure your evidence-based medicine practices are both equitable and impactful. Whether you're a healthcare provider, medical affairs professional, or researcher, this tutorial will equip you with the tools to adapt evidence-based medicine in a culturally sensitive and globally relevant way. Let's start by exploring the globalization of healthcare and its implications for evidence-based medicine. Over the last few decades, the world has witnessed incredible advancements in communication, travel, and technology. These developments have not only connected people across continents, but also accelerated the exchange of medical knowledge and innovations. While this progress is undeniably beneficial, it also brings unique challenges for evidence-based medicine. Think about this. A clinical guideline developed in one country is now often adopted in others, sometimes without considering the significant differences in population genetics, disease prevalence, healthcare infrastructure, and cultural practices. For example, a cancer treatment shown to be effective in a Western country may not be equally effective or even accessible in resource-limited settings. This raises a critical question. How do we ensure that evidence-based medicine remains globally relevant and equitable? Let's consider a few key areas where globalization impacts EBM. For example, health disparities and inequities. Globalization has shone a light on the stark disparities in healthcare access and outcomes between high-income and low-income countries. For instance, while advanced diagnostic tools might be standard in one country, they may be unavailable or unaffordable in another. Evidence-based guidelines that fail to account for these disparities can unintentionally widen the gap rather than bridge it. Population-specific evidence. Not all populations are represented equally in research studies. A significant percentage of clinical trials are conducted in high-income countries, with participants who often don't reflect the genetic, social, or cultural diversity of the global population. For example, drug metabolism can vary significantly based on genetic factors, which means a medication that works well in one ethnic group may have reduced efficacy or higher risks in another. Cultural beliefs and practices. Cultural beliefs play a huge role in healthcare decision-making. Take vaccines, for example. In some cultures, strong traditional beliefs or mistrust of Western medicine can impact vaccine acceptance, even when evidence supports its safety and efficacy. Similarly, mental health treatments that rely on Western psychological frameworks may not resonate in cultures with different understandings of mental illness. Global health crises. The COVID-19 pandemic is a recent and striking example of globalization's impact on EBM. The rapid spread of the virus across continents required swift, evidence-based responses. However, these responses varied greatly based on local resources, cultural attitudes toward public health measures, and the level of trust in government institutions. This highlighted the need for flexible, context-sensitive applications of evidence. Let's look at malaria treatment as an example of these challenges. While artemisinin-based combination therapies, ACTs, are the gold standard for treating malaria, their widespread implementation requires more than just evidence of efficacy. In sub-Saharan Africa, cultural beliefs about traditional medicine, economic barriers, and limited healthcare infrastructure often influence whether patients can access and adhere to treatment. By understanding these local contexts, researchers and healthcare providers can adapt EBM strategies. For instance, by integrating community health workers who educate patients about ACTs while respecting cultural practices. It's not all challenges, though. Globalization also presents immense opportunities for evidence-based medicine. Shared medical knowledge allows us to address emerging global health threats collaboratively. Multinational clinical trials and global health initiatives are helping to build a more inclusive evidence base. For example, the inclusion of low and middle-income countries in vaccine trials ensures that the data reflects diverse populations, improving the applicability of results worldwide. As you can see, globalization is reshaping evidence-based medicine in profound ways. But to make the most of these opportunities, we must approach EBM with cultural competence. This brings us to the next chapter, understanding cultural competence in evidence-based medicine. Cultural competence is a critical skill for healthcare providers and researchers aiming to deliver evidence-based medicine effectively. Why? Because healthcare does not exist in a vacuum. Every patient, community, and healthcare system is shaped by its cultural, social, and economic environment. So, what is cultural competence? Simply put, it's the ability to understand, respect, and effectively interact with people from diverse cultural backgrounds. In the context of evidence-based medicine, it means adapting practices and guidelines to ensure they are relevant and accessible to different populations. Let's break this down further. Imagine this scenario. A clinical guideline recommends a specific diet to manage diabetes. While the evidence is robust, the diet includes foods that are uncommon or unaffordable in certain regions. Without cultural adaptation, the guideline fails to achieve its intended impact. This is where cultural competence comes in. It ensures that evidence-based recommendations are meaningful and applicable across diverse settings. Here are some key reasons why cultural competence is indispensable in evidence-based medicine. Improving patient outcomes. Culturally tailored interventions are more likely to be accepted and followed by patients, leading to better outcomes. For example, a smoking cessation program in the Middle East might focus on the cultural significance of shisha use, while a similar program in the United States might emphasize cigarettes and vaping. Building trust and engagement. Cultural competence fosters trust between healthcare providers and patients. When patients feel their cultural values and beliefs are respected, they are more likely to engage with care plans. This trust also extends to public health campaigns, where cultural sensitivity can determine the success or failure of initiatives. Reducing health disparities. By considering cultural, linguistic, and socioeconomic factors, culturally competent EBM helps bridge gaps in care. For example, bilingual educational materials and interpreters can make a significant difference in ensuring non-native speakers fully understand treatment options. Cultural competence is not something you achieve overnight. It's an ongoing process that involves three key elements: awareness, recognizing your own cultural biases and how they might affect your decisions or interactions with others; knowledge, gaining an understanding of different cultural practices, health beliefs, and social determinants of health; skills, developing the ability to communicate effectively and adapt practices to meet the needs of diverse populations. For example, when working with indigenous communities, healthcare providers might need to understand the role of traditional healers and integrate their practices with evidence-based interventions. Let's explore how cultural competence applies to real-world evidence-based medicine. Clinical trials. Ensuring diverse representation in trials is critical. For instance, the inclusion of women, ethnic minorities, and older adults in cardiovascular research has highlighted differences in treatment efficacy across these groups, leading to more personalized care. Health education. When educating patients about evidence-based practices, materials should reflect their cultural context. For example, visual aids with culturally appropriate imagery can make a significant impact in promoting health literacy. Public health campaigns. A vaccination campaign in a rural community might need to address cultural myths and misconceptions before introducing evidence-based recommendations. In India, cervical cancer remains a leading cause of death among women, despite the availability of evidence-based screening methods. Cultural barriers, such as stigma around discussing reproductive health, often deter women from seeking care. By incorporating cultural competence, like engaging female healthcare workers from the community and using culturally sensitive communication, public health programs have significantly increased screening rates. Cultural competence transforms evidence-based medicine from a rigid framework into a flexible tool that meets people where they are. It's about taking the time to listen, understand, and adapt. Because when we respect the diversity of human experiences, evidence-based medicine becomes truly universal. Let's now move deeper into the challenges and opportunities of applying EBM in diverse cultural settings and explore how to navigate these complexities effectively. Delivering evidence-based medicine in a multicultural world isn't always straightforward. Diverse populations come with unique needs, beliefs, and healthcare structures, which can sometimes conflict with standardized evidence-based guidelines. However, these challenges also bring opportunities to innovate, adapt, and create more inclusive practices. Let's start with some of the most common challenges. Cultural variability in health beliefs. Health is not just biological, it's deeply influenced by culture. For example, in some communities, illnesses might be attributed to spiritual causes, which could conflict with biomedical explanations. This disconnect can make it difficult to implement evidence-based interventions. Take hypertension management. A physician may recommend medication and lifestyle changes based on clinical evidence. However, in a community that believes in herbal remedies or spiritual healing, this approach may face resistance unless adapted to include these perspectives. Resource limitations. Many evidence-based guidelines assume access to advanced healthcare infrastructure, which isn't always available in resource-limited settings. For instance, a treatment requiring regular lab monitoring may not be feasible in remote areas with limited healthcare access. Language and literacy barriers. Communicating complex medical evidence to populations with varying levels of health literacy or non-native language speakers can hinder the adoption of EBM. If patients don't fully understand the evidence or recommendations, they are less likely to follow them. Ethical considerations. Applying EBM globally raises ethical questions, particularly when interventions are tested in one population but implemented in another. For example, is it ethical to promote a medication in low-income countries without ensuring affordability and accessibility? Now, let's turn to the opportunities that arise when addressing these challenges. Co-creation with communities. By involving local communities in the design and delivery of evidence-based interventions, we can ensure they are culturally appropriate and well received. For instance, working with community leaders to promote vaccination campaigns has proven effective in overcoming cultural resistance. simplified guidelines for resource-limited settings. Developing simplified, resource-appropriate versions of evidence-based guidelines can expand their reach. For example, the World Health Organization, WHO, creates tailored protocols for low-resource environments, such as simplified tuberculosis treatment regimens. Culturally adapted health education. Digital tools, such as interactive apps or videos, can be customized with culturally relevant imagery and narratives, making evidence-based practices more relatable and easier to understand. Strengthening local research. Encouraging research within diverse populations ensures that the evidence base becomes more inclusive. For example, initiatives that fund clinical trials in low and middle-income countries contribute to creating guidelines that reflect local realities. Let's consider maternal health guidelines as a real-world example. In many low-income countries, traditional birth attendants play a central role in childbirth. Evidence-based guidelines may recommend facility-based births, but enforcing this without considering cultural norms can lead to resistance. An adapted approach involves training traditional birth attendants in evidence-based practices, combining cultural respect with scientific rigor. This strategy has improved maternal outcomes in several regions by blending modern and traditional care. One of the biggest takeaways is that applying EBM globally requires balancing fidelity, staying true to the evidence with flexibility, adapting to local contexts. Think of it as creating a bridge between science and culture, where evidence-based practices meet the realities of diverse populations. Now that we've examined the challenges and opportunities, it's time to focus on actionable strategies. How can we ensure that cultural competence becomes a fundamental part of evidence-based practice? It's not enough to understand the importance of these considerations. We need practical steps to apply them effectively. Here are 4 strategies to get started. 1. Conducting a cultural assessment. Before implementing evidence-based practices, start by assessing the cultural and social context of the population. This involves understanding health beliefs. What are the prevailing attitudes toward healthcare and illness? Preferred communication styles. Are they formal or informal? Face-to-face or digital? Barriers to access. Are there economic, geographic, or social constraints that might limit the adoption of interventions? For example, when introducing a new diabetes management program in a rural community, a cultural assessment might reveal that patients prefer group education sessions over one-on-one consultations. Actionable tip. Use tools like focus groups, community interviews, or surveys to gather this information directly from the population you're serving. 2. Building multidisciplinary teams. No single individual can fully address the cultural nuances of a population. Multidisciplinary teams that include healthcare professionals, social workers, cultural liaisons, and community representatives are invaluable. For instance, in a cancer treatment program, a team might include oncologists, nutritionists familiar with local diets, and community leaders who can address cultural stigmas around chemotherapy. Actionable tip. Ensure that team members reflect the diversity of the population being served. This not only improves cultural competence, but also builds trust with the community. 3. Adapting evidence-based guidelines. Evidence-based guidelines often require adjustments to be effective in diverse settings. Here's how you can adapt them while maintaining scientific integrity. Simplify language. Rewrite technical guidelines in plain language for patients and communities. Adjust resources. Tailor interventions to fit the available infrastructure. For example, in areas without advanced diagnostic tools, focus on clinical observations. Include local practices. Integrate traditional or cultural practices where they align with evidence-based goals. Real-world example. When implementing postpartum hemorrhage protocols in rural areas, some programs have included traditional massage techniques alongside evidence-based treatments like oxytocin. 4. Measuring and evaluating impact. Finally, it's critical to measure whether culturally competent approaches are working. This involves tracking outcomes, monitor changes in health metrics such as treatment adherence or patient outcomes. Gathering feedback. Regularly ask patients and community members about their experience with the intervention. Refining strategies. Use this feedback to continuously improve your approach. For example, after introducing a culturally adapted mental health program, surveys showed higher patient satisfaction and increased follow-up rates, demonstrating the program's success. These strategies don't just benefit individual interventions. They create a ripple effect, improving the overall trust, equity, and effectiveness of healthcare systems. When cultural competence is woven into evidence-based practice, it becomes a tool for creating solutions that are not only scientifically sound, but also socially and culturally resonant. Let's wrap up. Over the course of this tutorial, we've explored the critical role of cultural competence in evidence-based medicine, from recognizing global challenges to implementing practical strategies. Remember, evidence-based medicine isn't a one-size-fits-all solution. Its true power lies in its adaptability. By embracing cultural competence, we ensure that EBM meets the needs of diverse populations, bridging gaps, and creating equitable healthcare systems worldwide. Thank you for joining me on this journey. If you have questions or insights, feel free to share them. And don't forget to stay curious, stay adaptable, and keep pushing the boundaries of what evidence-based medicine can achieve.